MS is an issue that affected my family personally. My wife's father suffered with the disease for many years. And so when volunteers and activists from the National MS Society visit my office, I listen. Some of your stories inspire and give hope. Some bring tears. But they all renew our determination in Congress to take action.
I didn't really decide to become an MS advocate. I became one because I have MS.
I wanted to be in a position to instigate change, to break down barriers. That's what advocates do.
I just love working on these issues because, you know what, we wear the white hats at the Capitol.
Well, I think one of the things people need to understand about the advocacy enterprise is that it is a lot of fun.
Even if you are one person going in to make a visit, you are one person that counts.
When I first came to Olney, I had to try to be independent. I learned to point things out. As I came to the bank, there was no opening. I always had to wait for somebody to come up. And so I just got in touch with the person at the bank who was in charge of maintaining the facility. And I pointed out to him that it would be very nice to be able to access the bank easily. And lo and behold, he put in an opener on the bank. I am determined. My favorite reply to being turned down is, "I'm not going away." I never think about what's been accomplished. I think about what needs to still be accomplished, and also to maintain what already has been accomplished.
The thing that I'm most proud of in the Wisconsin chapter is that in the 3 years that I've been on the Government Relations Committee since its inception, I've had the opportunity to watch it grow, and I've seen more people get involved. I ask people, or I tell people, that I want to be involved in advocacy because there are a lot of things that we can change if we get together and we speak out together in one voice to make the change that we want to see.
When I first found out about Scott having MS, it's very scary. But it's only scary because it feels like you're out of control, like you can't do anything.
My husband and I are both caring folks just as well as the next person. However, because MS has affected our family, we're not only wanting to care what happens with our son and other folks, but we want to be doers also.
Advocacy has really grown in Minnesota. We have seen some huge changes in the past number of years. I think one of the most exciting things that happened in the past year was in 2005 we introduced the Minnesotans with Disabilities Act of 2005. And on our lobby day we had 150 people with MS coming to talk with legislators. And after that, they got 40 legislators who were willing to be co-sponsors of our bill. And you could just see what a huge difference it was making in the lives of people with MS. They were excited, you know, they were thrilled that they were able to have such a success with their legislators. And at the end of the session, the bill passed. We had $95 million of new investments for people with disabilities in Minnesota.
One of the very important things that I can do as a neurologist is to advocate on behalf of my patients. What I provide for them is incomplete unless I ask for the tools that I need to make them whole. I had so much more credibility when I went to the Hill because I was asking for tools that would make it easier for me to take care of my patients.
I don't think I started this process trying to become an advocate, but I ended up being one and discovering that I was one all along in taking the approach that nobody's going to know my issues better than I know them. I don't want to go through life just having things happen to me. It's hard enough when you have MS that things just happen to you as it is no matter what you do.
I really like to call myself an activist because it means that I take action. And I like to talk about the National MS Society as an activist organization because it means that we really will take action on something that we believe in. We believe in this and we're going to act on it.
I think it behooves all of our citizens who care about their loved ones to be involved, to speak up, to demand that their federal government make a higher priority out of finding a cure for MS. If people will get involved, they will be heard.
Since my diagnosis a little over a year ago, I've just grown more and more appreciative of the work that people have done before me. We've made a ton of progress and we can make a lot more. So I think the most rewarding thing about advocacy is even being able to look over a short period of time and say, look how far we've come. We've still got more work to do, but I want to be a part of that, and I'm going to be there.
As a former community organizer, I can tell you that real change begins with the conviction of one person. One person with MS who's not afraid to speak out. One person who sees an injustice in our healthcare system and takes action. One person who has the courage to advocate day after day, even when it gets hard.